Welcome all for Module 3 Bioethics. We are going to start with the lecture 1, that is Fundamentals of Bioethics. Introduction to Bioethics. Bioethics is a dynamic and evolving field that examines the ethical implications of advancements in biology and medicine. It intersects with various disciplines including philosophy, law, medicine, and public policy to address complex moral dilemmas arising in healthcare and research. The primary objective of bioethics is to provide a framework for making ethical decisions that respect individuals' rights, promotes well-being, and ensure justice in the practice of medicine and biomedical research. Understanding bioethics. Bioethics encompasses a wide range of issues from clinical decision making and medical research to public health policies and biotechnology. At its core, bioethics seeks to answer fundamental questions about how to balance competing values and principles in situations involving human life, health, and well-being. This involves applying ethical theories and principles to real-world scenarios to guide decision making and policy development. What will be the scope of bioethics? Bioethics is a multidisciplinary field that explores the ethical dimensions of advancements in biology, medicine, and related sciences. It extends across various domains including clinical practice, research, public health, and biotechnology, addressing a broad spectrum of moral issues and dilemmas. This lecture explores the diverse areas encompassed by bioethics, illustrating its relevance and importance in modern healthcare and research. The scope of bioethics is vast, reflecting the complex interplay between scientific progress and ethical consideration. Bioethics covers a broad range of topics. Clinical ethics involves the ethical issues that arise in patient care and medical decision making. Research ethics addresses the ethical concern related to biomedical research, including issues like informed consent and the use of human subjects. Public health ethics deals with ethical questions in public health policies and practices such as vaccination programs and disease prevention strategies. And environmental ethics, which considers the ethical implications of environmental conservation and the use of biotechnology in agriculture and industry. Clinical ethics, as we discussed, that clinical ethics pertains to the ethical issues that arise in the context of patient care. This includes everyday decisions about diagnosis, treatment, and end-of-life care. Central to clinical ethics is the principle of autonomy, which mandates that patients should be able to make informed decisions about their own health care. This involves ensuring that patients are provided with comprehensive information about their conditions, treatment, and potential outcomes. Informed consent. Informed consent is a key concept in clinical ethics, requiring that patients understand and voluntarily agree to proposed treatments. For instance, when a patient undergoes a surgical procedure, they must be informed about risk, benefits, and alternative to the surgery. Beneficence and non-maleficence guide healthcare professionals to act in a ways that promote the well-being of patients while avoiding harm. Decisions about the use of life-sustaining treatments such as ventilators or dialysis often involve complex ethical judgments about the balance between prolonging life and ensuring quality of life. Public health ethics. Public health ethics focuses on the ethical issues related to population health and health policy. It involves balancing individual rights with the common good, particularly in the context of disease prevention and health promotion. Issues such as vaccination policies, quarantine measures, and resource allocation during health emergencies, for example in pandemics, are central to public health ethics. For example, as we all know that during the COVID-19 pandemic, public health measures such as social distancing and mandatory vaccinations raised ethical questions about individual freedoms versus public safety. The principles of beneficence is reflected in efforts to protect public health while justice addresses the need for equitable access to healthcare and resources. Bioethics in biotechnology. Biotechnology encompasses a range of technologies that manipulate biological systems for practical applications. This includes genetic engineering, cloning, and the use of stem cells. The ethical implications of these technologies are profound and complex. Genetic modifications of organisms, including humans, raises ethical questions about the extent